My condition was stage 4 breast cancer, bone cancer. Prognosis about 18 months. Conventional medicine would make me comfortable for about 18 months, they figured.
The choices that I had to make after I discovered once I was diagnosed with cancer, that's where the pressure comes in, right? You're going to go see an oncologist and they're going to give you their 3 formulas, which is surgery, chemo, and radiation. I was very nervous on choosing any of them, but I did go ahead and choose the surgery. The tumor was big, it was stage 3, it was in my lymph nodes, and so that's very scary. And we went ahead and had the surgery. 14 lymph nodes were removed, and then you have to then make the next decision. What are you going to do after surgery?
When you first came to us, there was a rather large palpable area in the breast, right?
Yes.
I actually measured it, with actual a measuring device. It was 9 by 10 centimeters.
Here at Brio-Medical, I got several treatments, a lot of them to do with energy and how you move the energy in the bodies around. But probably the main one here for me was the hypothermia. And all the research that I had done on cancer, after you find out you have cancer, you do a lot of research, was and I'll say it, the Cadillac, the best for bone cancer. And that is where they heat you up and essentially put you into a fever state. And that treatment, I didn't realize I had a lot of pain. I don't think I still had a lot of pain when I got here, but any pain that I had in any of my bones was gone after the first treatment from that.
The treatments that I received here at Brio was quite a bit. So the IV therapy is quite a bit, especially the vitamin C, getting used to that. And then there was also the hyperthermia. Then there are all the PEMF mats that that help clean the cells and get rid of the cellular waste and help with the mitochondria, I understand. And then also, oh my goodness, the IPT. I didn't know what to expect, but that was one of the easier treatments. And when I left here, I felt good. Yeah, I didn't feel like that my immune system was going to crash or I was going to be sick for the next couple of days. Mm-hmm.
And so what I wanted to do is to bring you back and highlight how you're living, right? Mm-hmm. As you heal. And so it's not that you have to do them separate. You're actually living while you heal. Mm-hmm. So I wanted you to highlight what it's been like this summer, how you're returning to normal life and what that looks like.
Mm-hmm. Okay. Just to go back a little bit of the history.
Sure.
We finished here in November, and pulling out that day with a clear PET scan was the best day of my life. And then continuing to have clear PET scans up until just recently.
How many have you had?
I've had 4 clear PET scans.
Right.
Brio-Medical will give you the hope, the information. They'll tell you why they're doing something and why they're stacking therapies and how they're stacking therapies for your particular cancer. Not just a general, we're going to do this, that's all we're going to do. Mine was very specific. So the hope that they give you is one of living, one of looking forward. I get to go home, and that's the best that I could ever ask for. And I know God has something to do with everybody's life, and I do believe that He is blessing me with the ability to be at Brio, but all the doctors are blessed also here for their knowledge.
I don't know how you say thank you enough, and I don't want to cry because my makeup looks really good today. But Brio has been wonderful, and The care has been wonderful. The staff, they're so genuine and so kind. And that just makes all the difference because you're in a whirlwind of emotions when you're told you have cancer. And you have to be your greatest advocate. And they're going to do their best job that they can do here, but you are still your own advocate. And if you fight for yourself and you have a team here that wants you to succeed, it's the best formula. And you're going to do great. Yeah.
And so I think it would be great to add in, we were talking before we started recording about you had gone to get an ultrasound and the radiologist, and you had mentioned something that she said. And so if you're willing, I think that would be helpful.
Yes, well, when I was going through my 3D imaging ultrasound, and she did 2D as well, but it's here, right here locally. I'd never have been exposed to that before. But it was an amazing experience. And in our initial conversation, she said, "What are they doing for you?" And I tried to explain it, some of it. I said, it's integrative. I get traditional, but it's low dose. It doesn't kill my entire body. I didn't lose my hair. But I still do some traditional things along with all the goodness that comes in through the holistic, and I'm not sure if I'm using the right word, but the wholesome things that you put into my body and the other therapies, the many therapies that we go through here to help the body heal outside of traditional medication. That's the amazing part that makes all of this work, I feel like, and you know that, is the combination of traditional medication. You're not ignoring what the cancer treatments that are out there. You're just implementing them in a way to heal my body, not destroy my body.